Today we're talking about COVID-19 and mental health. We know that mental health and COVID and life all kind of goes together. So it's going to be an exciting conversation. Some things for our audience. We will have a couple of poll questions coming up that you can answer during the conversation. You're also welcome to put your questions in the chat. We will get to those. Also, it's going to be an engaging time. So definitely if you have any questions, feel free to just put those in the chat. So my name is Rosemary Robinson, and I have the pleasure of serving as head of operations for Acclinate. Acclinate, now included, has been here about 3 years now. I'm one of the first full-time hires, and we've seen a lot of growth. And this now included platform is designed just for you in mind as we talk about and navigate health, complete health there in the African American community. I am gathered here today with two of local therapists, Ms. Mary Anita Thomas and Ms. Doris Bell. At this time, I would ask if Anita will introduce herself to the audience.
Well, good afternoon, everyone. Thank you for having me here tonight. And I'm so grateful to share in this conversation with everyone. A little bit about myself. I am a retired psychiatric social worker with the state of Alabama with about 25 years of active social work. And several years ago, I was the Sharing Hope Coordinator for NAMI, Alabama. And we had the privilege to be a part of an excellent team that shared data with clergy and churches throughout the state of Alabama regarding mental health care and treatment and mental health resources. So I know quite a bit has changed, since I've been in the field. I actually retired in 2015, but the one concept that I think remains the same is that education and knowledge gives us the tools we need to make the difference.
Very good. And now Doris.
Hello, my name is Doris Bell. I'm a psychotherapist and licensed clinical social worker. Currently, I have my own practice in Madison, Alabama. I've been working in the mental health field for over 25 years or so. And in that time, I worked with a variety of people of different ages and in different settings. And I am very happy to be here this evening.
We're excited to have both of you ladies here with us today. And a little bit about myself. I'm retired from UAH after 32 years stint in student affairs areas. My last 10 years was in diversity. Also, I teach at Calhoun College psychology. So I teach human growth and development and general psychology. And I've always been curious about behavior and that of mental health. So we're going to have an exciting conversation today as we talk about and unravel some of the behaviors, thoughts, and then some practical things that we all can do as it relates to behavior. COVID has really gave us a lot of new terms, definitions that we use differently, new words that we use on a daily basis. And one of those words that we started to hear a lot of during COVID was self-care. Self-care. And today we're going to talk about self-care as it relates to the mind. Because as a human, we have that mind, body, and spirit that we have to be responsible for. But today we want to talk about a little bit about self-care. So Anita, if you would just give us a little information about what is mental illness.
Okay, thank you. Well, a mental illness, or some refer to as mental health disorders, refers to a wide range of mental health conditions that affect thoughts, perception, mood, and behavior. So you have clinical depression, anxiety disorder, bipolar disorder, and schizophrenia, just to name a few. And, the one thing about mental health, it's like any other medical condition like high blood pressure, diabetes, heart disease. It's nothing to be ashamed of. I always use the example that people don't appear to mind to expose a broken arm or a broken leg or to report that they've had heart surgery. But people, really feel uncomfortable about saying, I've got a broken brain. Mm-hmm. And it requires medical care. And it requires medical care just as well as those physiological illnesses that I just mentioned. And just like the broken arm, the broken brain can be treated. Just like the broken arm, you can return to a healthy level of functioning. And so that's what you can do. You can look, there's hope out there, there's treatment, there's medications out there so that you can have a functional, productive life.
Very good. Thank you, Anita. So Doris, we know that many times that with the African-American community, there's a stigma that goes along with mental illness, mental health. Tell us why you think that's the case.
Well, I think we have a stigma because it's been passed down for years through our ancestors, through our churches, just through our community. People seem to think that it's an embarrassment because it shows a sign of weakness, or that there's some spiritual component, something's wrong with you, or your faith is not strong enough. But none of these things are true. It's just like Anita said, mental health is just like your physical health. No one's going to look down on you if you have cancer or if you have a brain tumor. But if you tell someone you have bipolar or schizophrenia, the first thing they're going to think is, oh, this person's crazy.
Mm-hmm.
And crazy is not even a true definition within mental health. So it's just been something that's been long-standing, but thankfully with COVID, one of the good things that's come out of it is that people are talking about it more. And our community, they're starting to accept it more because it's not new just since COVID came. It's been here, but we've neglected to talk about it for years.
I'm going to put up a couple of poll questions here now for our audience to answer. And while they're doing that, I want to touch on what you just stated, Doris, that, people use the generalized term of crazy, and we understand that crazy is not a scientific term. But I recall in early psychology courses, it talked about when individual was experiencing behaviors that was abnormal, they would bore a hole in their head with the intent that that behavior, those bad thoughts, those evil spirits will have a way to escape. And as we think about that and we get placated with all the details of that, and we don't always continue to do that, what we need to do to take care of our health and to take care of ourselves. So it is incumbent on us to do the right thing. Mm-hmm. So Anita, please share with us, what are some ways that we can recognize within ourselves or our family members if someone is experiencing some mental disorders?
One thing I want to insert, Rosemary, that I think is important data is that we need to know exactly how we fit in terms of seeking, African Americans seeking mental health treatment. Mm-hmm. I wanted to, and I failed to mention earlier, pre-COVID, and only 1 in 3 Black adults with mental illness receive mental health care. Black or African Americans, whichever, are less likely to receive guideline consistent care. They're more likely to use emergency rooms than to seek out mental health assistance from a licensed mental health provider. And a lot of this has to do with exclusion from current research, education, health, and social and economic resources. So I wanted to add that in to let you know that pre-COVID, these were some numbers. Out of 12%, we make about maybe 12.9% of the US population. And out of that amount, those are the numbers that we're looking at. And as Doris was saying, as a result of COVID, yes, we see more African Americans seeking treatment. But when you know that person needs treatment, for a family member that's experiencing some unusual behaviors they can't actually identify, they just know something is wrong. You want to look for things as if they're, disengaging. And they're actually, let me just say this too, there are different kinds of symptoms that fit with a particular mental health disorder. But you do want to look for if the person is disengaged, because we do see more depression now, more panic and anxiety disorders. So if the person is not involved, if they are, just basically wanting to remain in one place, they're, very limited conversation, they become a little bit more isolated than usual. So those are some of the things that, you just want to keep an eye on, especially during COVID, because it has definitely required a change of mindset in terms of how we perceive an illness that has had such a huge impact on us and has created a whole new different lifestyle. And it's been very life-threatening. But I would say you would want to look for those things where people are, not really engaged with their family, they're more isolated, would be the main thing that you want to look at when you're looking for problems with mental health care. If they are becoming more angry than usual, look at their mood, kind of gear that. If they become easily agitated without really knowing the source of the agitation, if they're like changes in appetite or energy and interest. And a lot of people don't realize this, but problems with concentration, digestive issues, problems with sleeping, disruption in sleep. And then also another culprit is just whether or not that person begins to engage in substance abuse as a methodology of addressing that mental health issue. So you do want to look at all of those and just be alert, and not only in one particular age group, but across the board, because COVID has affected everyone.
Yes. And Anita, it's very interesting you said that, during COVID at its peak, they were stating how alcohol sales had escalated in all the different stores because everyone's home, isolated. They was drinking more, indulging more in probably drugs, but definitely alcohol sales was one of those things that really increased. Also, my family was spending times playing spades every night, card games going on. And you had all this time that we was isolated together. In many marriages, all that time together wasn't so positive. We also see that many marriages, felt detriment to that of COVID. Doris, could you tell us some things for those relationships that did make it through COVID, but are still feeling some stress from COVID and all the different mental things? What can these couples do to hang in there and try to grow together and get through this?
Well, the first thing is communication. Communication is everything. A lot of times we'll stay stuck in our own individual minds with thoughts that are unpleasing or unbecoming, and we just don't feel comfortable sharing them. When you live in the house together, when you're a couple, when you're a family, you need to feel free to communicate openly with one another. And in addition to communicating, trying to do different activities, things to break up the monotony of what you seem to think is your life. During the height of COVID, I would encourage couples, go for a walk together, take a long drive together, have a picnic in your backyard, just do something different that allows you to enjoy one another's company. It's difficult when you're used to being in the house by yourself, or when you're used to not being in the house, you develop your own routine. And now here the two of you are, and you're infringing on each other's space and time. So it would become a little difficult for some people, but a lot of people that I spoke with, they've learned to work it out. And it wasn't just difficult for married couples. I've had clients who have come to have poor relationships with their parents and other family members due to their controversy or opinion on the vaccination. So there was a lot of things that were upsetting to people, but communication is the key to working through all problems.
Yes, and communication is so important. And even I think that may be one of the barriers that African Americans don't seek out counseling, because we don't want to share. We don't want to be transparent and be judgmental. So we think if I tell someone, then they'll know. My mom used to always say, the neighbors won't know we're out of sugar if we don't go borrowing sugar. So people won't know that you have an issue if you don't go seeking help. But then it becomes from being that of an acute issue to being chronic. And that's when we get into these areas of schizophrenia and mood disorders. And Anita, talk a little bit about mood disorders. We think about, we coin phrases like I'm having a bad day, I'm having a bad hair day, but at the illness of that, when it's become chronic with mood disorders, talk about mood disorders for us, Anita.
Well, when you're dealing with mood disorders and you're talking about, if the person has been pre-COVID diagnosed with mental illness, or has it just been kind of escalated by COVID. When you're dealing with that, you're dealing with the change in behavior. You have some highs and some lows, not just your normal. We all have mood disorders. As you said earlier, we all have bad days, but this is different. This is taking it up a notch. And when it gets to the point that you're not able to communicate with the person, and you have to realize, along with a mood disorder, there can be some psychotic symptoms that go along with that as well. And what I find about COVID is that people began to isolate themselves in their home, and then the natural trend of receiving mental health care, we kind of pulled away from that because we were just a little bit timid about going outside of our homes. And I think that we let some things kind of slack. We just kind of felt really uncomfortable about making those connections with our dentists, or, there were different setups of how we were to make contact with our general practitioner. And with mental health, there's always that issue pre-COVID of seeking out mental health care when things are not going well, or you're not, you're getting off of your meds, or you don't even realize at that point that you're really as unstable as you are. And so that's always, that issue that comes up when you become non-compliant with your medications, or, because of COVID, you're just not able to get into the correct treatment facility that you need to get in, or connect with your mental health provider. For African Americans, that has always been an issue. But then you have, like I said, you have to take it up a notch when you're looking at COVID. So mood disorders, they're very serious. You should look for those kinds of things, but you should also address the fact that, did that person have a mental illness prior to COVID, and what kind of treatment are they getting during this process, and that would cause them to decompensate or regress to the point that they become unmanageable. Other than that, if you can find healthy outlets to address this, your mood, and you're not at a point, or have never been at a point where you require medications because you have been prior to that time diagnosed with a mood disorder such as bipolar disorder, then there are some healthy outlets that you can engage in. But I always say, do not hesitate to connect to a mental health provider if you need to, and don't be ashamed to seek out treatment.
That is great information, Anita. And we will be at the end of this call this afternoon sharing some resources that we all can seek out assistance on. I have the polls going now. They're starting to answer those questions. And one of the questions on the poll is, did you contract COVID? And I was very fortunate. I did not contract COVID myself, but I had siblings who did. I had loved ones who did. I had family members who died from COVID. I had a coworker who lost her mother-in-law and father-in-law during COVID. And it was at the very height of COVID. They couldn't even make the trip to Louisiana to be with the family. So, and I was telling my colleague to really watch her husband, because, those signs of PTSD later was going to hit him. So not being there the moment you're trying to deal with it, but it's that time later. Can one of you please touch on post-traumatic stress disorder and how it affects us as a race and as a people? Anyone of you want to touch on post-traumatic stress disorder? No? Okay. Well,
yes.
yes.
Yeah.
Okay. All right.
Okay. Was that a question that they had? Was PTSD?
Yes.
I was that with COVID, it would be very common to experience that.
Yes.
It's just one of those things where we have never been through the trauma that we've been through. Now, when we look at our race and we look at African Americans, we were like caught with like a pandemic within a pandemic, if you know what I mean.
Yes.
And so not only were we dealing with COVID, but in the midst of that, we were dealing with the George Floyd issues, the Breonna Taylor issues, the killings and shootings all over. And then in the midst of all that, we had African Americans out protesting. So that is enough in itself to make you just want to go into a depression, just go crawl in a hole and never come out, because of the severity of what we experienced during that time was not something that you could just push in the back of your mind. And I remember looking at TV, and I remember seeing all the protesters out there in the midst of COVID, in the midst of an illness that could just take you out. But yet you were out there in the middle of all of that. Some people were wearing their masks, some were not. The vaccine was not available at that time. So, you were just kind of out there, but you were out there for a cause that you felt was needed. So that's why I say with us, we just kind of got like a 1-2 punch. You know what I mean?
Yes.
Hit with COVID, hit with racial tension. I mean, all at one time. And then also all of the other issues that we deal with, lack of access to mental health services as we should as African Americans. We don't get that same kind of treatment. You just have to call a spade a spade. We don't get the same kind of treatment as our counterparts, okay? We don't have the same level of health care. I mean, if you really do the research, and you'll find that not do we have access to that kind of health care that our counterparts do. So you've got all that to consider, as well. When we have struggled through COVID. So for us to have post-traumatic stress syndrome, for us to have to deal with those issues, yes. And I do know of some people who are struggling right now. I think it manifests itself in the form of anxiety and panic attacks. A lot of our young people, and I may say this across the board, they kind of felt like cheated, like we want to go out, but at the same time, do we want to go out and do we want to catch something, this mystery illness? We don't know where it is, but we know we can get it. And do we want to bring it back into our family? Because we know as African Americans, we're very family oriented. We're very close knitted. And so when we come back in for like you said earlier, or someone was saying early, family dinners, get-togethers, and those kinds of things. You don't really feel comfortable. The things that glued us together as a unit, as African Americans, as COVID just kind of began to strip that down. The little things that we could hold on to, church and family. Yes. I didn't mean to go that far.
You're fine. And we're going to address that more in just a moment, but we do have a question in the Q&A. And the question is, this is an individual who did experience PTSD and is now having nightmares. Is there any suggestions for this individual? Any for the night?
I would say, and I know Doris probably in private practice probably could add a whole lot more than I could, but I would say, if you're having severe symptoms, seek treatment. There is treatment out there, and we're going to discuss that, but don't let it get to a point where, you're having thoughts of self-harm, or you're having thoughts of, I don't want to live like this any longer. This is just too much for me to bear. Don't be afraid to seek out treatment. Don't try to bear that alone. And even though we are resilient in our culture, sometimes that's to our demise. So don't hold back. Just say, hey, look, I need help. There's treatment available. There's Doris that's available in her practice, and she can talk to you more about that, about what she offers. But, bite the bullet, get the treatment, get the care.
Great answer. Thank you for that, Anita. I'm one of 12. And as we stated, African-American culture is all about family. And being that I'm a baby boomer, I was born at a time that we wasn't just having large families because we love children. These parents, these kids was part of a workforce. We was there to help on the land and to help with the crop. But being a one of 12, I'm a very family-oriented person, like you said, Anita. We was getting together once a month at my family's home house. Both my parents are deceased, but we would still keep that tradition of gathering. When during COVID, that wasn't happening. So Doris, talk about your experience that you had with your mother during COVID, and then what it was like also for those of us who was going to worship services and could no longer do that.
Well, it was a very difficult time for my mom, and it still lingers on for her. My mother happens to be a pastor in New York, and she also happens to have lupus. So with her having lupus, she had to be particularly careful about contact with other people. And with her church, she's the person who would do the counseling, premarital counseling. She would do funeral services, weddings. She would do outreach. And so she was used to being on the move. And with COVID, she had to stay in the house. She was able to do some counseling over the phone, but it wasn't the same for her. And with her not having the opportunity to be mobile, it also affected her physically. It made her lupus symptoms worse and her energy level dwindle. I also had a grandmother that during that time, prior to COVID, she would go to the senior center daily and she enjoyed it. She would make arts and crafts, play bowling, all types of activities. And she just loved to be with her friends. But once COVID shut that place down and she was just at home while my family members still had to work, so there was times that she was there by herself, she just decompensated. And eventually she did actually pass away during that time. So I tell people COVID has killed people even without them actually catching the virus, you know.
Yes.
And in my house, I have a 17-year-old son. I had COVID, which I still have long-term effects from. But in the beginning, my son was so difficult in dealing with because he did not want to stay at home. He did not want to wear a mask, typical teenager. So it was a time getting him to fully understand the seriousness of it and to have him comply with our house rules,
I had two of those that I was dealing with, Doris. At the time, I had a 21-year-old and a 23-year-old who was considered essential at their place of employment. Well, I kind of trumped that, you're not going to work, because I saw what, not just so much with the COVID being essential, we didn't have a vaccine, as Anita stated, but also driving at night, two young Black men in the height of police brutality. I wanted you home as much as I could, that I can protect you as much as I could. So very interesting that you would say that, but they did not believe it early on. And as the numbers grew with deaths, my two believed it. Came vaccinated and everything before it was said and done.
Well, even in the beginning, they were saying that the young people weren't necessary as compromised. So that didn't help me at all at home trying to convince my son. He thought he was invincible for a while. It wasn't until I actually got sick that he realized, okay, this is real. The real thing is happening in my own home.
This is real. Then we had officials who was telling the world that it was a hoax. So we was really battling a lot. So I have another question here. Individual wants to know, what are some coping things that we can do at home if we have signs of anxiety and depression? Either one of you can take that one.
Yes, there's a few things a person can do. Actually, there's a lot of things a person can do. But be mindful of what you're experiencing. Take the time to journal some of your thoughts, some of your feelings, some of the things that you feel just aren't quite right about you at this time. Also, talk to your loved ones, friends. Of course, as Anita said earlier, seek out professional help. There's a variety of ways to do that now. You don't have to physically go in an office if you don't want to. You can use telemedicine, and it's a variety of different agencies that are offering that. You can also go for a jog, do some arts and crafts, take on a project in your home that you always wanted to do but didn't seem to have the time for. Just find things that you enjoy and kind of lean into them. Allow it to carry you, and allow your gratitude for what is positively going on in your life to also carry you.
And I like that. Just with anything part of our body, we have to take care. But we forget just how much a good diet and walking, getting the sunlight can make a difference. If you like to dance, dance any movement that can cause our energy levels to change and to really kick in on those neurotransmitters and change the endorphins that we're feeling at the time to a place that feels better. So now we're talking about, schools were out for a while. We had students at home with us. We was trying to be a teacher. We were trying to be a mom, an employee, a spouse. It was a lot going on. So how did you all navigate COVID, personally?
I personally felt blessed that I didn't have to stop work. My routine did not change other than taking the precautions.
Okay.
I went to work every day. I did my job every day, and my job is my normalcy. It's what I focus on the most outside of my family. So for me, that was very helpful. I found that a lot of people who did have to stop working, their job was their anchor in their life. So when there was no job, they had no schedule, they had no routine, and they just would feel lost. They would feel like they was floating. So I had to, encourage people, create your own schedule. We all have housework to do. There's always some laundry or some dishes or vacuuming. Actually put it on a schedule so that you could feel that there was a consistent routine and some normalcy. And for me, I just feel blessed that I was able to go to work. My husband was home and working, and yes, I did not want to necessarily be here 24/7 with him working from home.
When, work was my scapegoat, and I had to work since I was 16, and I was used to being with the students at UAH, and I was also an event planner, so no weddings was going on. So I was like completely shut down. And my sanctity was I had a little great nephew that I would keep a couple of days a week. And that was my time to get down and play and be a child for a moment. And even in that, I still felt the stress. I was watching CNN. The numbers were so depressing. I had girlfriends to say, turn that thing off, Rosemary, because the numbers just became to be overwhelming to me. And then I couldn't go to church was my next outlet. There was no church. Even we went to the church house early on, before they first started saying, stay 6 feet apart, being able to see one of the elderly ladies in the church and just say hi, but could not hug and embrace them. I felt like I was being disrespectful to see a senior person and not greet them with that hug. All you could say was hello. So it was a lot of things that really, really changed, and it affected us long term. And even according to several of the theories, say we all have an element of mental illness. And a mental health checkup is good. You go yearly for your mammogram, you go every 5 years for your mammogram, you get those full body physicals once a year. We have to put our mental health and ourselves on that list also, and not be ashamed of it. We need to understand that as we get older, our brain get older. As Anita said, if it break, we need to get it fixed, right? So Anita, share with us some resources with the group that they can utilize in the event themselves or a loved one needs some assistance.
Okay, the one thing I wanted to mention, we spoke to stress a little bit, but I did want to mention that stress is, I think, the main culprit for many of our problems. And the one thing is that mental health is physiological health. If your mental health is not intact, the rest of you will not be. And so that's the first go-to, is making sure that you're taking care of yourself mentally. That's just so important. But there are some resources out there that you can automatically tap into. And I don't know if these resources are running right now, but there is NAMI. And NAMI stands for the National Alliance on Mental Illness. They have a helpline, and that helpline number is 1-800-950-6264, or you can text 6264. And then there's also your local NAMI group. And when we're talking about Madison County, there is NAMI Huntsville. And that number is 256-534-2628. So you can also contact your local NAMI. It's a good resource for family members. There's a suicide prevention and crisis line, which is 1-800-273-8255. And you can also Google these numbers. You can Google your local National Alliance of the Mental Illness, and don't forget your local mental health center providers. I mean, there are local mental health center providers throughout the state of Alabama, and you can Google that as well and find out who is the mental health center in your area, and tap into those resources. And don't feel afraid to do that. And also be open. And I think Ms. Rosemary had mentioned that, be transparent with your loved ones. And as Doris was saying earlier, communication is the key. You know, you got to talk about it, and you have to be listeners, and you have to be observant, and you have to know when it is time, and that home fixing isn't the remedy. And I know we're resilient, and we like to do things and deal with difficult situations on our own. But there are times where we need help. Yes. We are not an island unto ourselves. We must have help. People need people. And this is the one thing that we need to enlighten our African American community about. Don't be ashamed. Don't let anyone make you feel ashamed. You know, don't let them belittle you or demean you. And if you begin to have mental health issues, if you start to have a panic attack, and those panic attacks become unmanageable, hook up with a mental health provider. Let them know, hey, look, I need help. And if necessary, if you need treatment and medications, get those. Many people take high blood pressure medications, and they're going to take it because they don't want to have a stroke. And many people will take their diabetes. Why? Because they don't want to find themselves in a compromised situation where it may be life-threatening, and take them out. And a mental illness is no different. It can take you out if you do not take care of it. Depression is real. It is not fictional. You cannot just pull yourself up out of a deep clinical depression. You may need some antidepressants to address that issue. And be open to that and take those medications. And so just keep those resources in mind, and be sure to call if you need help. Call if you need help. One more thing I want to say, let your clergy know. You know, as African Americans, what do? We're struggling with something. We always go to our pastor, or we go to a leadership staff person, and that's just our go-to. But I think it's important for ministers and pastors or clergy in the church to be educated regarding mental health care. So if they begin to see signs and symptoms in their congregation, then they'll be able to link them to the resources that they need, and they're not there suffering. And you won't hear of so-and-so, committed suicide last night, and you're in total shock. But there are some red flags there that we can be aware of, so that we can get them help, and we can be an asset to them, and let them know that it is okay if you need help. You know, prayer is the first line of defense. We pray for one another, but then we know we need treatment, and we need to, accept the reality of that.
Yes. Thank you, Anita, for that information. It is so critical. And as you have stated, in the Black culture, we go to our clergy for many, many things. Many times they raise us, they baptize us, they marry us, they bury us. And in between that window, that dash, we need to seek out assistance with them. During the COVID, we partner with some local churches in Birmingham and in the Black Belt that was needing assistance. And we was asking the clergy there, who was a trusted source, to tell us, how can we help you help your congregants? Because many times it was us who did not want to get the vaccine. It was us who was dying at rapid numbers. So we reached out to the clergy, and they was willing to help us to tell their congregation what needed to be done, getting them the facts of what was going on in our communities. Also, we did a town called Hobson City, which is located in Calhoun County. They have an African-American mayor there who reached out to us, again, wanting to know what can we do to help them educate their citizens so that they can make well-informed decisions about healthcare, about COVID, about mental illness. So many times we are our own best advocate. We have to get out there. We have to ask the questions. I'm reminded of, many of times we was locked in the house. We was eating everything we could find in the house and everything, and we gained weight. The COVID-19 and 20, and everybody was starting to have, but that eating was stress eating, as Anita alluded to. It was just stressful. We was in the house. We just wanted to snack. So Doris, now that many of us have these COVID-15, 20s that we blame it on COVID anyway, what are some things that we can do physically that will also help with the weight loss? It's also help to reduce these stress levels.
Well, first, before I answer that, I just want to add on another way that a person can reach out for help. If you already have a trusted relationship with your primary care provider, don't hesitate to talk to them about it. If they can't help you, they will direct you, but a lot of times they can. So that I just wanted to add that. But as far as getting off the weight, as I can say, I'm one of those people who need to do so. Going back to just physical movement, like you were saying earlier, if you enjoy dancing, lean into that. Go ahead and dance around your house, have fun, take walks, do yoga, Pilates. Anything that moves your body is counted as exercise, at least in my book. So just get the movement going and you'll be all right. And watch what you're eating though. Now that you're not as stressed, hopefully, you could be mindful of what you're actually putting in your mouth. Make healthier choices.
I like that. Sounds like a great salad for dinner. Ladies, I want to thank you for your time. Miss Anita and Miss Doris, it's been a great conversation, but it doesn't end here, audience. We have a platform called Now Included. If you will go out to nowincluded.com and join the platform, you will get to read about different types of health disorders, health issues, and just healthy discussions. We share recipes out there. We also just talk about day-to-day health things. What are you doing? And these are ways that we can now educate ourselves among the Black community. We here at Aclinate Now Included created this platform for us to have a place to come and have these conversations, to be transparent with each other. And we as ladies need to take, we always that caregiver in our homes. We can now tell our sons, our husbands, our male friends how they need to do. Don't be afraid if you don't feel good mentally to get that checked. Don't let it go unnoticed and going undiagnosed. So we just want to thank each of you who have joined us today. I'm looking at the poll question. Did you contact COVID? We had 29% that said yes, 71% that said no. The second question was, has the pandemic affected your mental health? I love this transparency. 62% says yes, and 38% said no. And I told my friends early on when COVID first was being diagnosed in the area, that if we never sneezed or never coughed, that we will be affected by COVID. And we have been. We was all isolated. We couldn't go to our normal routines. We couldn't hug our parents, our grandparents, our friends and loved ones was dying. We could not be with them in their last hours. Price of food went up, everything went up. You could not have access to certain things. If you was an online shopper, things was getting delayed. So, and that'll stress you out. You order a new bed and it takes you 6 months to get that bed in. I mean, that was causing some anxiety and stress also. So, but we all some kind of way was affected by COVID. We have another question here that I'm going to look at and see here. We have a question, ladies. What is the current process to seek involuntary treatment when an individual refuses to seek psychiatric stabilization? So we're going to turn that over to our psychiatric social worker. What is the process to seek involuntary treatment when an individual refuses to seek assistance?
And I know Doris can help with this. That is a problem. We have been, actually, Doris and I have had conversations about just overall mental health care and the direction that it's going in. And one of the things is contact your local mental health center. That would be the first go-to, I would think. And again, you do have the mental health center in Huntsville that covers Huntsville, Madison, but there are several throughout the state of Alabama. Make that initial contact, find out what that crisis line is and call them and let them know, I've got someone that's very sick and unmanageable and I cannot handle their behavior and something needs to be done. Also, if it gets really bad, just call 911. Don't just let things escalate there, but pull in a resource and get someone in, that is trained. There should be, maybe mental health officers out there who are trained in the community so that they can help navigate you through the system. And as well as, like I said, the mental health center, because there will be those times when you're going to be caught kind of between a rock and a hard place, and you're going to need help and you're going to need it quick. And you don't want anyone to be in a dangerous, life-threatening situation where they're a danger to themselves or other people. So you definitely want treatment and you want it rapidly. Again, if you have a loved one that has a mental illness, begin to look for behaviors early. Sometimes some things just kind of go unnoticed, I know, because life happens. But if you know someone that has been diagnosed in your family with a mental health care issue, or you're beginning to see some behaviors for the first time, don't let it get way out of control. Just say, hey, look, this isn't just the norm for my loved one. Something else is deeper going on here. I need to, if they can't seek the help, then I need to find out some ways that I can get them the help. Because you do need the cooperation of the person that's experiencing the illness. Mm-hmm. You need their cooperation. You cannot, pull them in, but you need, but when they're very sick, most likely you're not going to get very much cooperation from them. And therein lies the issue. When you have someone that's very sick, they need treatment and they need it rapidly, and you're struggling. But I would say always your go-to is to your mental health provider in the community. And I would also, I think we have excellent community mental health centers out there. I know of Huntsville, Madison. I know that they have good resources and they know how to deal with patients who are in crises. So utilize that. If you do have a private healthcare mental health provider and they have a number that you can call them, and then they can route you to the correct direction that you should take, because I know that there's some new things out there now, so I can't speak to everything, but I do know that you don't have to just sit there and suffer, that reach out, get help. Don't be ashamed. If you have to call 911 and say, hey, look, this is out of my hands, I cannot do anything. Call, I need a mental health officer. Do you have a mental health officer? These are questions that you want to ask. They're just, I can't manage this behavior, and start to and see what that will lead you to. But certainly don't sit there in the house and know that those are some serious issues that can result in a tragedy. You don't want it to get to that point.
Totally agree. We echo that. The third question in the poll we have here is, did the pandemic cause emotional stress on those in your local community? And we had 86% that say yes and 14% that said no. The fourth question, do you have a regimen for maintaining your mental health? 86% says yes, good job, kudos to you all, and 14% that says no. Your 14% that said no, you now have some resources here. You have some at-home tips you can use. And most of all, you can get out there on that asphalt and start walking and dancing and just making yourself release some of that stress. And many times, someone asks the question about how do you manage work stress? And work stress is just like home stress. It's stressful on the body. The body doesn't know the source of the stress. You have to find ways to meditate. You have to find ways to unwind. You have to step away sometime from the stress in the workplace. You need to talk to those in leadership if they're causing the stress. They help try to minimize that stress. And if that stress is beyond you in that workplace, you need to know when to say enough is enough. And sometimes we become that stressor, and different stresses for different individuals. So you need to look and see what's the stress, what's the stressors, and then remove what you can remove from that. So it's been a great, great evening. I do want to say, please go on our website there in nowincluded.com, join the platform. And there's many, many different topics. We got groups out there for lupus, Alzheimer's, walking groups who just want to, ladies just talking about breast cancer, other cancer awareness. We as a community have to take care of ourselves. And this platform was built for us to have those conversations about our health, that we can live a long and prosperous life as we've been assigned to on this side of heaven. We hope you all had a great evening. We have enjoyed speaking with you. And on behalf of Anita and Doris, we say thank you, thank you, thank you for joining us. And for a quick moment, just take your finger and poke yourself. And let's just say, I will not suffer in silence. Go forth, have a great day, and be blessed.